take a look at these 3 wounds. Now, how will you choose the ideal dressing for each of these 3 wounds? Can you do a simple gauze piece dressing for all the 3? Will it be enough? Or do you need some special dressing for every of these wounds? So, hello guys, I'm Dr. Adarsh. In today's episode, I'll help you understand what are the types of dressings available and how do you choose the ideal dressing depending on the condition. Now, the first image is of a clean laparotomy wound. So here just a simple dressing would be enough, like a normal gauze piece dressing would be enough. Second image is the wound from where the graft was harvested, right? And here you have to do a paraffin gauze dressing. The third wound is a fasciotomy wound where you can choose the VAC dressing or negative pressure wound therapy. So what made me decide these dressings for these wounds? So that's our objective today. That's what we are going to learn from this video. Now, what is the reason dressings are required? Why not just leave them open? So let's understand what purpose does dressing serve, or what are the functions of a dressing. So dressing provides a barrier, preventing it from contamination. It acts as an absorbent material to absorb the exudates from the wound. The third thing, it provides a moist environment for better wound healing. And also it gives comfort to the patient. So an ideal dressing must be able to satisfy all these functions. Along with that, it has to be easy to use and it has to be cost effective. But as of now, there is no dressing which satisfies all these criteria. Even if it satisfies all the criteria, it would be very expensive. So what are the different kinds of dressing I want you to understand? And for that, I'll give you a simple approach. So let's not discuss the dressing one by one because otherwise it's going to be a theory class. So I'll give you scenarios and I'll help you analyze which dressing to choose and why are you choosing that exactly. And that's how surgeons choose the dressing. So whenever you see a wound, your thought process should not be like, what dressing should I use? First thing which has to come to your mind is, what type of wound am I dealing with? Is it dry? Is it wet? Is it infective? Is it healthy and healing? Right? So depending on what kind of wound it is, you will choose the available dressings. For instance, if it's a clean surgical post-op wound, like for example, in a post-op case of hernia, in a post-op case of thyroidectomy or MRM, so all these are clean surgical wounds, right? There are no exudates, there is no infection, the surgical site is well approximated. So what is this wound lacking? Absolutely nothing. It's healthy and healing. So therefore, you don't need any fancy dressings for this. And the biggest mistake you will be doing in such a case is overdressing these kind of things, right? Cleaning the site daily, changing the dressings daily. So by doing this, you will be inducing surgical site infection. So in such wounds, all you have to do is just a simple gauze piece and a paper plaster. After post-op day 2, you can even just keep the wound open. It will heal on its own. So for all the clean post-op surgical cases, simple dressing will be enough. And I don't think I have to teach you how to do a dressing ideally because you might be doing it day in and day out. Right? But still, you have to make sure you're following sterile technique. Right? Wear a sterile gloves and have an assistant with you. If not, just wear gloves on one hand and with the other hand, you can use the dressing material using a chittle forceps. So this is how a chittle forceps looks like. And with your non-gloved hand, you can use a chittle forceps and take the gauze piece or pad and put it in your glove cover. The inner part of glove cover is also sterile. So you can place the gauze piece pads there and with your non-gloved hand, you can pour betadine on the gauze, clean the area, dry it with a dry gauze piece, keep a dry gauze piece and just put a micropore. That's it. But if you have an assistant, well and good, you can wear gloves in both hands and ask your assistant to help you. The second type of wounds are dry wounds, where you can see the black necrotic eschar and there are no exudates and the surface is dry. Like most commonly you see these kind of wounds in peripheral vascular diseases and in diabetic foot and also in bed sores. So what is the problem here which is preventing healing? It's lack of moisture, right? So you have to do a dressing which can provide it moisture and we have 2 dressings which can do that. A gel kind of dressing which you can apply on the wound so that it will donate water or it will donate moisture and it can soften the necrotic tissue. And due to this moisture, it will promote autolytic debridement. So what is the hydrogel most commonly used? It's called hydroheal or you have intrasite gel which you can apply it. Then the third type of wounds are wet wounds. And depending on how much exudative the wound is, you can choose different types of dressing in this. Like for example, if it's a small burn wound or a small cut wound where there is minimal exudate, in such case, you can use something called the hydrocolloid dressings, right? So these are waterproof dressings which has a colloid material which absorbs the exudate and forms a gel kind of film. So it helps in retaining moisture and it also helps in wound healing. But remember, hydrocolloid dressings cannot be used in wounds which have very high exudates. Like for example, venous ulcer, exudative diabetic ulcers, or large traumatic wounds. In all these wounds which are producing a lot of amount of exudates, there is skin maceration and also there is constant soaking, right? And because of too much fluid, the wound healing is hampered. So in this case, you have to use a dressing which can soak this exudate but still provide a moist environment for healing. So for these kind of wounds, you can use alginate or foam dressings, and this is how the a foam dressing looks like, right? And we have most commonly used something called as tegaderm. It's a thick foam dressing which you apply on the wound and you can keep it for until 3 days. So it will soak all the exudates and it will promote in wound healing. Or you can use alginates as well, which are also excellent in soaking up the exudates. So for wet wounds, you can use hydrocolloids, foam dressings, or alginate depending on how much exudate is the wound producing, right? Now coming to the next type of wounds, which are infected wounds. Like for example, a surgical site infection, an infected diabetic foot, or any contaminated wound. And in these cases, none of the dressings are going to help in wound healing. You have to remove the infection source, you have to do the debridement, and only then your dressing will help, right? So if there is pus collection, if there is necrotic tissue, you have to remove it. For these kind of wounds, silver dressings act wonderfully because silver possesses antimicrobial activity, right? So in infected wounds, you can use silver dressings for the best results. And you have variety of silver dressings like silver hydrocolloid, silver hydrogels, silver foams, silver alginate, and there's also nanoparticle coated silver dressing which is called Acticoat. That you just coat the wound with this dressing for 2 to 3 days and repeat it until the infection is controlled. And once the granulation tissue forms, you can switch to normal dressing. You can just use saline soaked gauze piece until the wound heals. So in infected wounds, remove the bacterial source, that is drain the pus, debride the necrotic tissue and use silver dressings for better results. And the fifth type of wounds are necrotic wounds. The previous ones were just infected, but here necrosis has set in. Like for example, a dirty diabetic wound or a pressure sore, a bed sore, where you have no granulation tissue, there are dead necrotic tissue, right? And there's a lot of slough. So in these cases, you will have to do debridement. That's the first step. And after aggressive debridement, you can apply something called as a VAC dressing. That is a negative pressure wound therapy, which will help in acceleration of the healing process. So the negative pressure will induce angiogenesis, will induce formation of granulation tissue, and it will also help in removing the exudates. So a VAC dressing is a type of dressing which can enhance the healing process or which will stimulate the healing. So remember, the best dressing for a necrotic wound is scalpel. So only with proper debridement you can promote better wound healing. Otherwise, no amount of dressing can help it. So in a case of necrotic wound, debridement followed by VAC would be the ideal dressing approach. So how does VAC work exactly? So there is this foam which you place on the wound. You cover it with an airtight seal, right? You have to make sure it is vacuum sealed. There are adhesive tapes which comes along with it. So you have to apply it and make sure it is airtight. So you make a tiny hole on that and you connect the vacuum pipe and switch on the vacuum, and the pressure has to be minus 125 mm of Hg, right? So that pressure is gonna suck all the exudates out and it will promote wound healing. So you can use this in laparotomy wounds as well, in burst abdomen as well, in fasciotomy wounds, in diabetic foot. So any deep wounds where you want to promote healing quickly, you can use this, right? And you can keep the VAC dressing intact for up to 3 days and you can repeat it for multiple settings. And if VAC dressing is not available, you can create your own VAC setting. That is, you can take multiple pads, right? Place it, take a Riles tube, make some extra holes in it, then keep another layer of pad, right? And seal it with adhesive tape. Like most commonly you can use something called as ioban, right? Which you use during surgery. So you can wrap this up with ioban and you can connect the Riles tube to the suction. And even this VAC works really good. So remember the importance of VAC dressing, remember the importance of debridement. Even after debriding, if there's still some slough left or You can use a chemical debridement agent that is known as a debridase or a debris free. Right? It contains papain and urea, which helps in breaking down the slough and which causes chemical debridement. So you can keep applying this on the wound and slowly the slough will keep on getting reduced. And to promote granulation tissue, you can also use Placentrix ointment that is made of placenta extract, which will help in proliferation of granulation tissue. So either aggressively debride so that no slough is left and apply vac, or if aggressive debridement is not possible, debride as much as possible and apply debridase and Placentrix. Now, another types of wounds are healthy granulation tissue, and these are the wounds which you find after the VAC therapy. Right? You can see bright red tissue which bleeds on touch. So, most residents make mistake here that they again try to aggressively do dressing for it, like daily cleaning it with betadine, doing a gauze piece dressing, daily changing the dressings. Right? If you do this, you will be damaging the healthy granulation tissue and you will be hampering the wound healing. So what your priority has to be is to protect the granulation tissue. So you have to use something which is non-adherent, right? And you have something called paraffin gauze, which is a normal gauze which is coated with paraffin. So this is a non-adhesive dressing which you can use on healthy granulation tissue. And you can do it until the wound is fit for skin grafting. So skin grafting is also a type of dressing, remember this. And another type of wounds are cavity wounds, which you see when you do IND, right? In gluteal abscess, in fasciotomy wounds. So all these are deep cavity wounds and your priority has to be in obliterating the cavity. Otherwise, there can be collection in that cavity which will hamper the wound healing. So what you can do, you have to obliterate that space. So you can either use foam dressing, alginate dressing, or you can either use VAC also, which will help in healing and promotes granulation tissue in that obliterated space. So this is a simple algorithm for you to choose the ideal dressing. If the wound is dry, you have to use hydrogel, that is intrasite or hydroheal ointment. If the wound is wet or if it's highly exudative, then you can use foam dressing or alginate dressing. And if it's not so exudative but still producing some exudate, then you can use hydrocolloid. If it's infected, do the debridement, do silver dressing, or you can also apply VAC. And if you're not able to debride it completely, you can use the chemical debriding agents called debridase, which contains papain and urea, and granulation tissue promoting agent, which is made of a placental extract called Placentrix. If the wound has healthy granulation tissue, protect it with the paraffin gauze. If it's deep, then again you can use VAC or you can pack it with foam dressings. And if it's a clean surgical wound, you can just do a simple gauze dressing and later you can just leave it open. So don't memorize dressings, try to apply whatever you have learned today, try to analyze the wounds and try to choose the ideal dressing by applying this knowledge, because you will grow in your ranks depending on how well you manage a post-op case, how well you manage your wards. And if your seniors see you managing the wounds well, then you will be promoted soon to perform an OT, right? So keep learning and keep improving.